The U.S. Department of Agriculture, USDA, announced that tests conducted on ground beef purchased at retail stores have shown negative results for bird flu. This announcement comes after the USDA conducted testing on meat samples collected from states with dairy cattle herds affected by this year's unprecedented outbreak of the virus in cattle. The USDA emphasized that these negative test results reaffirm the safety of the meat supply. They attributed this safety to the rigorous meat inspection process overseen by the USDA's Food Safety Inspection Service, FSIS. The FSIS inspects each animal before slaughter, ensuring that all cattle carcasses entering the human food supply meet the necessary safety standards. The National Veterinary Services Laboratories tested a total of 30 samples of ground beef purchased from retail outlets in states where dairy cattle herds had tested positive for bird flu. While dairy cattle in 9 states have tested positive for the H5N1 strain of the virus, primarily affecting milk production but sparing the cattle themselves, the ground beef samples showed no signs of contamination. Further testing is underway, including examining beef muscle samples from condemned dairy cows and studying how cooking beef patties to different temperatures affects the virus. Dr. Jose Emilio Esteban, USDA Undersecretary for Food Safety, emphasized that while they are confident in the safety of the meat supply, additional testing aims to enhance scientific knowledge and provide further assurance. The USDA's increased testing requirements for dairy cattle moving across state lines were implemented last month in response to the outbreak. Concerns were raised after a mutated version of H5N1 was detected in the lung tissue of an asymptomatic cow sent to slaughter. Additionally, signs of bird flu have been detected in retail dairy products, with some milk samples testing positive. However, the FDA has clarified that these are likely harmless fragments of the virus left over after pasteurization, with no live infectious virus present in the products. Despite these findings, concerns remain about how the virus has entered the milk supply and the challenges of tracing its origin due to the complexity of the dairy supply chain. Health authorities are continuing their efforts to monitor and mitigate the spread of bird flu in both cattle and dairy products.